Welcome to the Vibrant You Health Show with your host, Blake Bars. At Nature's Pantry, our mission is to lead you to vibrant health through the best nutrition, supplementation, service, expertise, and healthy choices. In this show, we aren't interested in fads or quick fixes. Rather, we want to get into the holistic fundamentals of health. We want to answer questions like, what are the underlying causes to health issues, and what solutions can help lead us to vibrant health? You can watch every episode and listen to the podcast by visiting our website at naturespantry.life. The Vibrant You Health Show is brought to you by Terry Naturally Vitamins and Solar Ray Vitamins. At Nature's Pantry, we strive to work only with companies that maintain the highest standards for quality and efficacy. Terry Naturally and Solar Ray are two of the absolute best.
3, 2, 1.
All right. Welcome, everybody, to episode 55 of the Vibrant You Health Show. I am humbled and honored to have my special guest today, Dr. Thomas Levy, who is a world-renowned cardiologist, author, and speaker. I've read many of your books, Doctor. Thank you so much for joining me today.
My pleasure, sir.
And I've had the pleasure of listening to you on several podcasts. Dr. Artist Show, Jonathan Otto's Health Series several times. I enjoy reading some of the articles you publish on orthomolecular.org. And I don't know if I have a favorite book of yours. I definitely, in the top 3, is probably Curing the Incurable, Vitamin C, Infectious Disease and Toxins. Do you have a favorite book that you've written?
Well, probably Rapid Virus Recovery. That covers a lot of grounds and also covers a lot of the more recent issues that I've been dealing with and evolving protocols for treatment that weren't necessarily touched upon at all in the earlier books. So, but I mean, it's a close call on all of them. It's not like a favorite child or something.
Yeah. Yeah, I like that one too. That's really good. And that deals with a lot of hydrogen peroxide and vitamin C protocols.
Correct. Yes, sir.
And that's a really good resource for that. For those, one of the things I learned in that book that I didn't realize is hydrogen peroxide is actually one of the most abundant molecules in the human body, naturally occurring.
Yeah, well, think about it. Your 2 most important molecules in the body are oxygen and water. That's H2O and O2. And hydrogen peroxide is H2O2. Kind of an intimate relationship there. Combined with the fact that after hydrogen peroxide nukes a pathogen, what it leaves behind are water and oxygen. That's hard to beat.
Right. Absolutely. So that's something I was curious about. So once, and certainly this is something you should be careful about in personal use and read about and learn and be confident in how you use it, because you certainly want to use the wrong strength of hydrogen peroxide if you're going to use it for certain, either orally or nebulized or.
Sure. But as long as you're into following a protocol, it's pretty straightforward and pretty harmless.
Right. And I'm curious. So hydrogen peroxide, once the immune system uses it, it then divides into water and oxygen. Is that what you're saying?
Yeah, it's interesting because, of course, Rapid Virus Recovery was written to try to get the word out about hydrogen peroxide nebulization to deal with people having acute or chronic COVID or having had it a while. And people responded dramatically to it. But then again, we had some of the, let's go back to before this election, way back when they tried to just destroy Trump for talking about inhaling disinfectants. I forgot his phraseology. But the fact of the matter is, I don't know that he knew anything about what hydrogen peroxide does, but he was spot on, because hydrogen peroxide is actually the perfect antipathogen. Why would I say that? Well, especially for the respiratory issues. For the respiratory issues, as you inhale and bring pathogens into the lung and into the airspace, guess what? The epithelial cells lining the lungs naturally release hydrogen peroxide into the airspace to deal with those pathogens. So it's already the body's natural defense mechanism against new infectious challenges. And of course, all you're doing when you nebulize with hydrogen peroxide is you're augmenting a natural response that's been temporarily overwhelmed by the volume of pathogen coming in. And then, of course, as we just mentioned, what makes it even more perfect is not only does it non-specifically knock out any pathogen you can imagine, it leaves behind water and oxygen as the breakdown products.
Wow.
And what's the more perfect thing for dealing with temporarily damaged tissue, inflamed tissue that needs to heal, other than hydration, water, and oxygenation, oxygen? And then to take it even one step further for the lungs, all that water being made also helps mobilize and gets rid of the mucus and the pathogen debris. So you really, Mother Nature or God, depending on your religious alliances, it couldn't be more perfect.
That's really cool. I just think that's a really neat, and it seems like the more I learn about health, the more I realize the naturally occurring substances
Sure.
that God made are some of the most potent healing mechanisms we have. But the information about these natural substances seems to be somewhat limited, at least in the mainstream media and mainstream medical practices. Maybe partly because it's hard to you can't patent nature, and then you can't own the rights to it, and then you can't mark it up 40,000%.
But some people try to.
Okay, so we could talk about that for a long time, but the main reason I really was excited, I mean, there's so many things I would love to talk to you about, but I recently came across your interview with Dr. Jonathan Otto, where you were talking about your Super 8 vitamin protocol, which you're having some great results with for yourself and people you've helped with this. So tell me a little bit, maybe could you just real quick tell me the 8, and then would you be so kind to we could go through each one and kind of talk about them more in detail?
Sure, they're sort of in 4-packs, if you will.
Okay.
One affects calcium metabolism, the other affects ATP production.
Okay.
So the calcium-related ones are vitamin C, magnesium, vitamin D3, vitamin K2.
Okay.
The ones that directly impact and increase ATP, the energy molecule production inside the mitochondria, are niacinamide, riboflavin, coenzyme Q10, and methylene blue.
Okay, that's really interesting. So before we dive into deeper, I'm curious, why is dealing with calcium so important? And why is dealing with ATP energy production, cellular energy production, so important right now?
Excellent question. The straightforward answer is all pathology, every cell that is, shall we call it sick, too much oxidative stress, every one of those cells has too much calcium inside it. And until you bring that calcium down, you will never get enough vitamin C inside. You'll never get enough magnesium inside. You'll never get enough glutathione. As long as that calcium stays up, nothing else has a major impact on bringing that cell back to health until you bring the calcium down.
And that's calcium in the cell.
Inside the cell. And the agents that do that most effectively are, in fact, vitamin C, magnesium especially. Magnesium is the antithesis, the yin and the yang of calcium. As calcium is high and magnesium comes in, calcium goes up. The two of them can never be high in the same cell. The two of them can never be low in the same cell. You get magnesium in, you push calcium out. So that in many ways, singularly, makes magnesium one of the most important supplements out there, is because all disease has this increase in calcium, and magnesium is your primary way of getting that calcium level down. And then you have vitamin D, which makes sure you get enough calcium from your diet, but you don't require the ridiculous calcium supplementation that so many people are taking, which is highly, highly, highly toxic. And then vitamin K2 is very, very important for keeping calcium solubilized, dissolving calcium deposits, etc., and allowing the excess calcium to be excreted and not allowing new calcium deposits to develop. So in a nutshell, then, it should be viewed that high intracellular calcium is the cause and the marker of all chronic disease. And until you get that down, nothing else is going to have impact. And these four supplements, especially the magnesium, are super powerful in that regard.
So when you get calcium out of the cell, do you want it to go into the bone, or do you want it to be excreted, or both?
Well, it's going to go where it's going to go. The whole point is that's what happens is so many people have this because the old myth about osteoporosis. Yes, osteoporotic bones don't have enough calcium in them. They don't also have enough of hardly anything else in them. So the bones are not a calcium deficiency state, although they are low in calcium.
Yeah, it's
and
all
because
minerals. The bones are made of all minerals, right? Many.
right. And taking calcium as the primary way to treat osteoporosis is ridiculous because the studies clearly show it does not by itself. It will with vitamin D, but by itself, it will not rebuild new bone. And even more importantly, it will not, no matter how much you take, make you less prone toward an osteoporotic fracture, which is the ultimate bottom line. I mean, that's what the ladies and some of the older men are taking the calcium for, is because they don't want to fall and break a bone. Well, taking calcium doesn't prevent that, but it does accelerate massively your chances of heart attack and cancer.
Well, but the key here is that's why a lot of times you see these supplements with the complex. You have some calcium, some D, some K, some strontium, some boron, some plant-based calciums, and so forth and so on.
Some of those multiforms might be good, but they still do not need to contain calcium. You do not need, your body is in a state of calcium excess. Doesn't matter that your bones don't have enough calcium. They broke down for different reasons. They broke down due to oxidative stress, and how you treat them is an entirely different point. But the entire body, especially in someone that has osteoporosis, has massive oxidative stress. If you have one calcium deposit anywhere in your body, that's the clear marker that you have too much calcium there. And as I said, the study is very clear that when that calcium gets inside the cell, it massively increases oxidative stress. And although we might not have mentioned it before, oxidative stress is disease. Oxidative stress doesn't cause disease, it is the disease. So when biomolecules are oxidized, they become inactive, and their amounts, their numbers, their distribution, that determines what that disease process is in that cell or tissue. But no, you're not, the calcium does no good in any dose. The only thing I tell people that you definitely want to avoid all supplements that have more than 100 milligrams of calcium. Some of them might have in natural ingredients, 10, 15, 20 milligrams, but you don't have to get super compulsive about something like that. Something also that really contains massive amounts of calcium that most people don't realize and causes a lot of problems for a lot of people without knowing them are Tums and Rolaids. Okay, this is a calcium carbonate, and the dose of it, 500 milligrams or more, is a massive dose. It's like drinking an entire large glass of milk. And obviously, I think by that statement, you realize that milk drinking is never a good idea. People don't necessarily have to stop dairy entirely, but they have to understand the principles of calcium excess versus nominal calcium.
Right. And so you're better off focusing on, okay, so obviously you're better off focusing on magnesium, vitamin D, K2, and C because it helps your body deal with the excess calcium. But just as a side note, is there a way to get calcium into the bones along with other minerals? Because I've heard like D and K kind of help get calcium into the bones where it belongs.
Not only D and K, but in fact, calcium and vitamin C and magnesium. I mean, they have clear studies that show vitamin C as a monosupplement, just supplemented by itself, will increase bone density and make bones stronger. Okay, so no, all four of those not only work to get the excess calcium out of the cells, They also work to strengthen the bones as well as they can be strengthened. I say that because, you're 75, 80 years old. Don't be looking to restore your bones back to age 25, but
Right.
you can certainly strengthen them to the point where there should be very minimal chance of falling and breaking a bone.
Okay, very good. Okay, so touch on real quick, if you would be so kind, the four supplements, niacinamide, B2, CoQ10, and methylene blue for ATP cellular energy production and why that's so important.
Right. And before I say that,
Yes.
I always talk about the two primary goals to obtain optimal health and an optimal cell. If the cells are optimally healthy, the body's optimally healthy. And what takes a cell to be optimally healthy is normal levels of vitamin C and getting the calcium down, getting the magnesium up, synthesizing glutathione is all what ultimately results in getting normal levels of vitamin C inside the cell. So that's goal number one. And goal number two is to have maximal ATP synthesis in the mitochondria. And for those who don't know, ATP is your primary energy delivering molecule in the body. It's like a cofactor for so many enzymes to make them run, for active transport of substances from the extracellular space to the intracellular space. I mean, ATP makes the body hum. Okay. Now, what happens is ATP production takes place inside the mitochondria inside the cell. We hear a lot about mitochondrial and mitochondrial diseases these days. And basically, they all relate to the concept of you're not making enough ATP. Okay, that's sort of the bottom line. So
Right.
what happens is when you take in nutrition in the form of glucose and other nutrients, without getting into sophisticated biochemistry, and I'm not that sophisticated in it anyway, let's just say glucose comes in through something called the Krebs cycle. The is processed until it comes down into a form that can donate an electron to what's called the electron transport chain inside the mitochondria. And the electron transport chain has 4 steps. Those 4 steps are NAD, nicotinamide adenine dinucleotide. Second step is FAD, flavin adenine dinucleotide. Third step is coenzyme Q10 all by itself. And fourth step is cytochrome C oxidase. And from there, it fires up an enzyme called ATP synthase, which then starts turning out the ATP. But the bottom line is this electron transport chain is the primary metabolic sequence that turns the electrons in the food into the form of ATP energy. So these 4 steps are critical. Now, NAD, we've heard a lot about that. They got a lot of supplements out there, NAD this, NAD infusions, and
Yep.
I'm not negating any of that. Any way you can get more NAD inside your body, the better. But most of those supplements are very expensive and are suboptimal ways of getting the job done.
Right.
The way to optimize NAD in the first step is to take large amounts of niacin or niacinamide, vitamin B3.
Yep.
I favor niacinamide because I don't want anybody getting discouraged from the B3 flush.
Yeah.
That's
something we would deal with a lot. And I think that probably overall niacin maybe has the full flush niacin may have more overall benefits, but it's like a hard thing for people to deal with because you don't want to turn red and be hot and tingly for half an hour in the middle of your day or whatever. And so ultimately I tend to go to what is practical for people. And that's where the niacinamide is more practical.
Right. And the niacinamide, this has been proven very elegantly by Dr. Abram Hoffer in the 1970s because of the fact that niacinamide basically massively upregulates ATP production. Dr. Hoffer found that giving 3,000 to 6,000 milligrams of niacinamide a day, along with about, I think, 4 or 5 grams, of vitamin C, he was able to cure most chronic schizophrenics. So, I mean, that should have been Nobel Prize worthy alone for him right there. But of course, we know how the natural remedies get completely ignored. So, I mean, if somebody comes along and discovers a new chemical that moderately decreases the symptoms of schizophrenia, that'll get the Nobel Prize rather than a natural substance that completely resolves the condition. Right. So anyway, so niacinamide is a critical part, all right? The second step is flavonoadenine dinucleotide. And ironically enough, interestingly enough, the primary precursor. See, the niacinamide is the precursor to NAD. That's the stuff that you need to make NAD. And the stuff that you need to make FAD is vitamin B2, riboflavin. And riboflavin, I generally talk about taking 400 milligrams a day. And let me just address a little area of confusion for a lot of people. A lot of people and docs will say, well, I'm on this multivitamin, multimineral, and look, that's got riboflavin in it. Yeah, most of those riboflavin, multivitamin, multiminerals have 2 to 4 milligrams. Okay, so we suffer a lot. Definitely, it's good to take a multivitamin, multimineral, but don't let it delude you into thinking you're adequately dosing anything. All right, so it's better than nothing, but don't have it convince you the fact that you're properly dosed on vitamin C, or that you're properly dosed on niacinamide, or that you're properly dosed on magnesium. But for somebody that needs an economic help and wants to take something, yes, then a good quality multivitamin, multimineral is in order. Just don't believe the fact that you've covered the bases completely.
Right. It's going to help you from becoming deficient. Like 90 milligrams of vitamin C, the RDA, is enough to keep you from getting scurvy, probably. And RDA, recommended dietary allowance or amount, would be what I term as a ridiculously deficient amount. But you're not. It's not a therapeutic dose.
There you go. That's a good way to put it. Yes,
helping with a health issue.
Exactly. And then number 3 is, it's probably the most expensive of the supplements, but it's one of the most important ones too, and that's coenzyme Q10. I mean, coenzyme Q10 is just a power generator. I mean, it's very critical. I think a lot of people now realize, a lot of docs, that when you have a failing heart, a heart that's not contracting well, it's nearly always deficient to severely deficient in coenzyme Q10. And getting that dose up, you can actually gain serious points on your ejection fraction on how well your heart could contract. As a cardiologist, I didn't know that 30 years ago, but I know it now. And so here's though where I have my Super 8, and I have suggested dosages, but by the same token, I also recognize economic problems, constraints. And so I would say try to be on some of each one, and if at points times your pocketbooks allows you, you can increase on the niacinamide, increase on the CoQ10, increase on the vitamin C and the magnesium. So coenzyme Q10, if you want to do it optimally, in my opinion, you need to take 600 to 1,000 milligrams a day, and that's expensive. Most of the supplements are 100 or 200 milligrams. But if that's too pricey, stick with the 1 to 200, because you're still getting more than an additive effect. You're getting a synergistic effect that all 8 of these supplements do together. It's not just 1 plus 1 equals 2. It's like 1 plus 1 equals 3 or 4 or 5.
Right.
And then finally, last but definitely not least, is methylene blue. Ironically enough, methylene blue is not a nutrient. It's one of the first synthesized drugs that we know of, and it is not in any way a natural product. But as fate would have it, it has all the characteristics, antioxidant-wise, of vitamin C. It's incredible. And it's also a very small molecule that's very easily absorbed, passes the cell wall very easy, no constraints, and very quickly after your first dose gets in fairly high concentrations into the central nervous system. So it bypasses the blood-brain barrier very easily. Now, what does it do in the electron transport chain in the mitochondria? Well, just like a guided missile, it goes straight to the fourth complex, skips the first three. It goes straight to the fourth complex, cytochrome C oxidase, donates an electron, and then stimulates the production of ATP right on the spot without even incurring any of the physiological degrees of oxidative stress that have to be generated for the first three cycles. So
Oh,
on something like this, I mean, many people, uh, when people are really talking about being super economical on their supplements, well, I say, well, you absolutely need vitamin C, magnesium, and vitamin D3. And probably number four would be methylene blue because it does so many things by itself that doesn't need a further assistance.
right.
But
Right. Well,
that's the super eight. And I tell you what, I mean, I've been telling. I don't make any money on it. I don't sell it. Maybe I should, I suppose. But I've been promoting it and having it out there for about a year now, and I've just had everybody under the sun get better. Now, let me qualify that. Get better doesn't mean cure. Obviously, we have a lot of conditions out there that are just not going to disappear. But I will tell you this: I would be flabbergasted at anybody with any condition who takes at least moderate doses of all eight of these to not feel substantially better and maybe feel better than they have in years.
wow. That's cool. And like you said, the cellular energy production is that, did you say electron transport chain?
Right.
The four?
Electrons are life. I don't say that lightly. I mean,
Yeah.
electron flow, electron donation, electron transfer. At least at this stage of our scientific understanding, who knows what we'll know 50 years from now? But right now, in all the models fit. I say that because you come up with an hypothesis. I mean, nobody's seen an electron, right? You come up with an hypothesis, and you see if in different models that hypothesis serves the purpose and is consistent with the characteristics that you've ascribed to it. And so far, that seems to be the case. I mean, with all the antioxidants, vitamin C, etc., they distribute the electrons. Your diet is used to bring new electrons into the body, and vitamin C and other antioxidants are used to distribute the electrons. And when you don't distribute the electrons, you're sick, or you don't have enough, you're sick.
Mm-hmm. Or you're not creating enough cellular energy.
Absolutely. Well, there you go. I mean, ultimately, those electrons, you need them in sufficient supply to get inside the cell, to go through the electron transport chain and fuel up that ATP. Yes.
Yeah, interesting. And each one of the four stages of steps of the electron transport chain, we're hitting here with these supplements. So the niacinamide for the NAD, the B2 for the FAD, and the CoQ10, and then the
cytochrome C oxidase.
Cytochrome C oxidase is the methylene blue.
Come up with these names, but that's the name.
and so you're helping get this whole process started with those first three. Then that fourth one is even maybe synergistically, and the whole process is synergistically impacted by the methylene blue.
Correct. Correct.
Kind of like when you're taking NAC normally, because it helps your body make glutathione. But once you take glutathione in addition to NAC, now your body's getting an extra boost because it's getting that synergistic effect from both.
Right. And the literature on methylene blue is nothing short of stunning. There's a number of articles that what methylene blue has been doing a lot it's known to be an antipathogen, but just like vitamin C, they have people in hospitals that either don't know about it, or if they do, they're never going to use it. Vitamin C, methylene blue, you name it. Right. Well, in India, where things aren't quite the same, they have a number of articles showing that methylene blue as a monotherapy, all by itself, pulled people out of septic shock. Okay, now you can't be sicker than you are with, short of dying, you can't be sicker than with septic shock. That's where every part of your body is oxidized, and you no longer have a blood pressure. You're breathing hard. I mean, you're on the slippery slope. Well, in a couple of these case reports, listen to this. they showed that, well, they did all the traditional thing. The shock means you lose blood pressure. So they start giving vasopressors to try to get the blood pressure up. They give it antibiotics. They give it corticosteroids. They give it everything they can think of, and the patient is going down the tubes. And in this particular case, coded. And they had to resuscitate the patient, bring him back, and then for some reason, at that point in time, they said, let's try methylene blue. And they started an infusion of methylene blue, and the patient gets dramatically better over the next 10 to 12 hours. And then for some reason, they say, okay, and they stop it. And then the patient goes downhill and codes again. And so they resuscitate him a second time, restart the methylene blue, and continue it until he's discharged 10 days later. But how powerful an agent is that can bring you out of that all by itself?
Wow. That's really cool.
Hey guys, I just wanted to talk to you a little bit about the supplements that Dr. Levy's talking about. All of these supplements are available at Nature's Pantry here in LeGrand. You can also order them online at naturespantry.life. Just click the shop tab. But some of my favorites here that we have for the vitamin C would be the vitamin C powder. I keep this on hand all the time, as well as the capsules. I sometimes just switch it up. Sometimes I get tired of taking capsules, so I do some powder and vice versa. And then here's the Libon Labs liposomal vitamin C that Dr. Levy was talking about right here. And that is the little packets. They're little gel packs, so you can squeeze them into water or juice. But again, that's liposomal Libon Labs, and it's in a fat molecule, so the absorption is exceptional in this product. I like that one a lot. For vitamin D's, I love the Terry Naturally. This is a D and a K together, so you could get them both together at the same time. It also has vitamin A, which is amazing. So I like this one a lot because it's a simple one that I can take 1 pill or 2 pills and get my 5,000 or 10,000 of D, and then I can get a really good amount of K in this one too. This Now brand has a lot of K in it compared to a lot of them, so that could be a good option for you as well. And then the Solar is another one of my favorites with the D and the K. If you're wanting to get towards those upper levels of K that Dr. Levy's talking about, you may want to get K by itself, but again, I think probably for me to simplify, I'll probably stick to like the Terry Naturally or one of these others that I showed you where I can just take 1 pill and get both of those at the same time. And I might double it up if I'm wanting to get higher amounts. With the magnesium, I really like magnesium glycinate. We'll keep working. I think we're going to get that chloride that he talks about, the magnesium chloride, but I don't think we have that yet. But typically what we recommend is glycinate because the absorption is so amazing. So I like to have a powder, and I mix this a lot of times with vitamin C powder. I'll mix it together, and I'll sometimes take some capsules. So this is the glycinate with 350 milligrams, and that's the one that you take 4 of these at bedtime. But again, a couple scoops of this is 400 milligrams. So again, I keep both of those on hand just because I like to mix it up, but either way is fine. And then for CoQ10, as Dr. Levy was talking about, the trying to get higher amounts of CoQ10 is kind of tough because it's a more of an expensive supplement. However, we do have this really high dose now. This is 600 milligram. So that would be an amazing one if you're wanting to hit those high levels that he's talking about. But then we also have the Solar Prosorb. So the absorption in this is 9 times better than most CoQ10 supplements that you'll find. And it's a 200 milligrams, so that would be excellent. You wouldn't need as much because the absorption is so much better. And then the vitamin B2 is the one he was talking about that's super important. So you're wanting to get the higher amounts of that. That's one you're probably gonna have to take by itself to get to those levels he's talking about. So I love the Solar brand for that. We have a Nature's Life brand that I love so much for the niacinamide. And this is 1,000 milligram. So you're going to get to the higher levels right away, but also we have several other options of different doses for the niacinamides. So, and then we have this Methylene Blue, which is one that you won't find a lot of places, but it's this Earth Harmony brand, which is one of the greatest brands. I love them so much. They came out with the Methylene Blue, super high quality, and you won't go wrong with this product. Again, most of these products we have on sale regularly, great deals. You can find those supplements here at Nature's Pantry and online at naturespantry.life. But also, I will make a flyer. When I publish this episode, I'll make a flyer that summarizes all of that. I'll include pictures of these supplements for your easy reference. And of course, you can always come talk to us here at the store at Nature's Pantry and be happy to help you. That's what we're here for. Here to serve, here to love, here to help people find vibrant health. So come visit us at Nature's Pantry, and we hope to see you soon. Have a blessed day.
Okay, so I think one thing that would be super awesome, because I want to make a flyer that kind of outlines this, would maybe start from the top, and let's just talk about amounts. And of course, everybody's unique. Everybody's nutritional needs are unique, and you kind of have to, and that's something I feel like we've lost, is a little bit of ability to be in tune to our own bodies and what we need, and the ability to, a lot of times in my experience, nutritional therapy, supplementation, diet, it's something that I would say maybe sometimes more of an art than a science, even, because I'm learning as I go with practice, trying things and dosing to see where I'm getting that sweet spot. Vitamin C, certainly dosing multiple grams a day for sickness becomes more of a learned practice than it is just like a, one a day kind of thing. It's a dosing. I know when I had COVID, I took 10,000 3 times a day, and I wasn't recovering as well. I never hit bowel tolerance. I didn't recover as fast as when I started taking 2,000 every hour. Once I started taking 2,000 every hour, I snapped out of it quite quickly, because vitamin C is better to take more often in smaller amounts because it's water soluble and the body uses it so fast.
I'm just writing on this right now. I'm working on my next book, and I'm actually addressing this topic right now. And the point is very well taken. For a lot of people, what's better, 50 grams IV over an hour or 12.5 grams of IV every 6 hours? And I'm going to tell you 12.5 grams every 6 hours is better.
Yep.
All right. You keep the blood levels up. And the same thing, as you dramatically showed for yourself, pertains to the oral. I mean, don't take a large dose every 3 hours. Take several grams every hour, unless, of course, you reduce the bowel effect, which you didn't. Just keep that on board. And then when you take it frequently like that, you also get a bigger percentage of the vitamin C getting absorbed and going inside your body. So no, definitely frequency. And the reason why we don't know about this is because the hospitals don't let you use vitamin C. If they did, it'd be so easy for the clinician to come in and say, give 5 or 10 grams of vitamin C IV every 6 hours, every 4 hours, go out and come see the patient again the next day. Can't do that in their clinic. In their clinic, maybe 1 dose, maybe 2 doses if they come in the morning and they leave late in the afternoon. So the degree to which a patient can be monitored has a lot to do with what's the best or most optimal ways to give them nutrients like vitamin C. But yes, multigram with vitamin C all the way. I might add too that I have a written thing on this that I could give you later on.
Okay.
That talks about these things too.
Great. That would be awesome. And then I would say, like, for normal maintenance, I typically just take vitamin C once a day. I've been in the habit of taking like 8,000 at bedtime all at once, but and like you said, you take the Live On Labs liposomal, which is really, you need 1,000 or 2,000 of that because the absorption is so high.
Correct.
And that's a great. It's liposomal, so it's in a fat molecule, so it absorbs basically 100%, basically as much as intravenous. Is that correct?
Pretty much. And the thing about it is, once it's in the blood, it's better than intravenous because it still has the encapsulation, which means it can go to the cell and merge into the cell wall, reverse pinocytosis, without the consumption of energy. When you take vitamin C unencapsulated IV, guess what? You have to use ATP to transport it into the cell. So you're robbing Peter to pay Paul. You're using energy to get an energy molecule somewhere else. Anytime you can make shall we say, a metabolic transaction or a physiological transaction inside the body without consuming energy, that's always a superior way to approach things to get things done. I'm all for IV vitamin C, but I tell you what, it's gotten really expensive, and it's gotten me to the point where I've had a lot more people, docs and individuals, working with larger and larger doses of the live-on liposome encapsulated vitamin C. And let me tell you, I think, all things considered, it's better.
Yeah.
Mind you, if I'm sick, I want both.
Yes.
But I mean, this is, and the downside is the company that makes that, Live-On Labs, has been so successful. There have been so many charlatans that have come along saying they have a liposome product and they don't. So, buyer beware.
Right, for sure, yeah. And the Live-On Labs company, which we have here at the store, is very reputable. And I've seen the results from it myself, and I know you take it yourself. But I'm taking 8,000 ascorbic acid, and you're taking 1,000 of the Live-On Labs a day maintenance dose. So that's a big difference. And the ease of application in your life. I would say, though, what I was going to say is I take that's like a when I'm well dose, but when I'm sick, I'm going to take it multiple times a day in smaller doses, just because I know that's more effective. And probably the same with the liposomal. You're probably going to take, 1 or 2 packets a few times a day or something.
Correct. Yes, sir.
Okay. So I know in your book, Curing the Incurable, you talk about the optimal dose for most people is between 6,000 and 12,000 milligrams a day of ascorbic acid. Is that kind of where you're still feeling like the sweet spot is?
Well, the optimal practical dose. I mean, when you're talking about theoretical, somebody should take up to whatever their bowel tolerance dose is on a daily basis. But I mean, that gets so complicated for so many people, and then gets people discouraged, and they end up taking nothing at all. That I like to bring it down to something practical.
Right.
I might say 6 to 10, 6 to 12, something along those lines that breaks up into 1, 2, or 3 grams 3 times a day, something along those lines.
Yeah.
Of course, the regular vitamin C. And
for sure.
Now, also, I might add, there's a very practical way to do that too. In some of my recent work, I found out, this sounds crazy at first if you haven't heard of it, is that the oxidized form of vitamin C is just as effective as the reduced form. That's because its job is not to bring electrons into the body, but to take the electrons that comes from the diet and distribute them. So its primary role is not to bring new electrons in, but to give the electrons that the diet provided to the different oxidized biomolecules. But what this means as a practical point is you can mix up your favorite beverage in either a jar or a big, something like that, and whatever the amount is, 10, 15, 20, 30 milligrams, and don't worry about it oxidizing, because as it oxidizes to DHAA, it gets even more effectively absorbed than when it's in its reduced form. So point being is you could just sip on that all day long. So that would be something that probably would be especially good for someone like you if you start feeling a bug coming on, is rather than just pop 1 or 2 every hour, just sip on that all day long, and then you really get a good, smooth, steady state of vitamin C inside your system.
Yeah, that's a great tip. Really good for practical use is to just mix the amount you want for the day into a bottle and sip on it through the day. Yeah, that makes it super easy. Okay, so yeah, and again, I think the dose for vitamin C is something you got to learn for yourself and figure it out. But again, do you ever get a bowel tolerance issue with liposomal?
No. Well, let me say this. I might, if I take 25 or 30 packets, 20 grams, I don't get the bowel tolerance effect. I get a greasy stool. In other words, the liposomes are oily.
Right.
So it just basically represents some liposomes that didn't get absorbed that make their way to the bowel, but it doesn't cause the massive bring in the fluid and having a loose stool, that sort of thing. So a loosened or greasy stool, but not the bowel tolerance. No.
Okay, yeah, and much harder to take that much to even get to that with the liposomal. So that's good to know. I've certainly mastered the bowel tolerance with the ascorbic acid, and I just know, like, if I start to get a little gassy, I'm like, oh, okay, I just went a little too far, and I back off just a little bit.
There you go. Yes.
And it's just one of those things. And I know with just a side note, Helen Saul Case talks about, even for infants, the mother can get herself up to bowel tolerance throughout the day for breastfeeding and really help the baby get a good amount of vitamin C too. We have an article. There was an article published in orthomolecular.org on that as well.
Right. Yes, she's a smart gal.
Which also gives a chart body weight for from 1 pound up through, or whatever, 10 pounds up through 200 pounds as far as the amount of C per day by body weight. Okay, so let's talk about magnesium. Dose, form, what do you like?
Magnesium, you want to get as many grams as possible a day, or I should say as much a day as possible. And just like the vitamin C, you never have to worry about toxicity from magnesium taken orally, because you'll get the bowel effect long before you get enough magnesium to have any toxicity inside the body. So you can work within those parameters. They have many different forms, as chloride, citrate, lysine.
Yeah.
Now, what I recommend, because it's both inexpensive and it covers pathogens better, is I advocate magnesium chloride. Magnesium chloride, believe it or not, back in the days, you might recall when Dr. Klenner cured all these cases of polio with vitamin C. Well, at the same time, they had a doctor in France, a Dr. Nouveau, who just giving, get this, magnesium chloride solution to infants, babies, children, and young adults. And he got just as dramatic a resolution of polio with that as a monotherapy as Klenner did with vitamin C. And then there's a lot of studies, although they're not widely published, that show that it has this unique antipathogen effect. Why magnesium chloride? Well, there's some studies that looked at magnesium chloride and magnesium sulfate. Sulfate's a very common form too, used IV. When they looked at a test tube examination of the virus, the viral culture, they found that the magnesium sulfate increased virus growth and the magnesium chloride knocked the virus growth out. So I just say, take advantage of the anion and the cation. Try to figure out what both contribute to the game. Chloride does a lot of good things on the antibacterial spectrum. I mean, just like maybe your mother or grandmother might have had you when you were a kid gargling with a little salt water, when you had the little sore throat. Very, very, very effective. So I go with that. Good to take as figure out your bowel tolerance for that, like that. You can augment it very nicely with a liposome encapsulated magnesium. It's a pricier way to do it, but if you're having a difficult time getting your magnesium up, it's a good way to go. And skin lotions, skin creams, those are good transdermal preparations. Epsom salts baths are a good way of getting it in there as well, and giving your body a relaxing dose of magnesium before you go to bed. I tell you though, the people that complain about the muscle cramps in the middle of the night, they might be well advised to at least take a try on a packet or two of the magnesium threonate liposome encapsulated before they go to bed. It calms the body and is
and that's a Live On Labs as well.
Live On Labs, yeah. It's the direct antagonist to the cramps that develop in the muscles.
How do you feel about like a glycinate? I know that's probably a lot of hype.
Very good, very good, very good. Well absorbed.
Okay, so
by speaking for the magnesium chloride, I'm not speaking against all the other ones.
Right. So chloride's one I've had trouble finding.
The easy online at most of it you'll get it in the powder form, but they do have if you go down about the fourth or fifth page, you know how Amazon is with all their things, you start seeing capsule forms of magnesium chloride as well.
I'll have to look into stocking that in the store here. I think we might have one, but I know we've been looking for it and haven't found it from our vendors. One of the issues we're seeing with Amazon right now is a lot of counterfeit product that looks exactly like the original. So one of the things.
Well, I know they counterfeit books. Well, I should say counterfeit books. They took my book Rapid Virus Recovery off about 9 months into its publishing and came up with 7 other little mini books with the same title. So I take that as direct evidence that the information was helping far too many people.
And then also we're seeing people selling things like vitamin C and elderberry D in a capsule that was white powder, and then they tested it and it was oat flour. And so you just got to be careful with online. It's best to get it straight from the manufacturer or from a source you trust, like our store here, Nature's Pantry, Live on Labs. On the magnesium, I've always wondered how come there's for vitamin C and magnesium, there's a vitamin C like sodium ascorbate, there's a calcium ascorbate, buffered forms. How come there's not a magnesium ascorbate? That seems like that would be an amazing form.
There is magnesium ascorbate. Yes, there is.
Okay.
And
is it really expensive?
It's an excellent supplement. Well, that's the downside. The point being is magnesium ascorbate, you're getting 2 of the most important supplements, with the same supplement. You're getting ascorbate, vitamin C, magnesium. Right. The downside is in order to take what we're talking about, recommended doses of vitamin C, that would be a very, very pricey form of magnesium ascorbate. So to take the multigram doses of both, it's best to take them separately. Mm-hmm. But that said, if you got a lot of money and you want to keep things simple, magnesium ascorbate's a wonderful supplement.
Okay. And then is it vitamin C and magnesium are really the 2 main supplements we're talking about with a bowel tolerance that we're trying to,
Pretty much. Yeah. Yes. That's the main 2.
Yeah. Certainly there's exceptions, especially because everybody's so unique, but those are the 2 that seem to have that similar effect. Okay. So vitamin D, what's your recommendation there?
Vitamin D is D3. We recommend it's the one that you got to get a blood test for.
Yeah.
At one point in time, most people are going to be low, and most people on somewhere between 3 and 10,000 units a day, they're going to settle in at a blood level between 50 and 100 nanogram per cc, and that's basically where you want to be.
Yeah.
That's pretty much what the positive studies have shown, and definitely you don't want it lower than that. I mean, a lot of nasty things happen with low vitamin D levels, and vitamin D toxicity occurs, but really with astronomical levels of vitamin D. So you can suffer very easily from a minimal vitamin C deficiency, but not that much from a mild vitamin D excess.
Okay. I know they say that normal range is 30 to 80 or 30 to 100 nanograms per milliliter of blood, but we want to be up above, up near the optimal. I know you said above 50 would be good.
Right. Yes. Sir.
And I know I've been supplementing 5,000 in the winter and 10,000 5,000 in the summer, 10,000 in the winter for a few years, and I've been tested twice, and my levels have been up near 80 both times I got tested. So
perfect.
I know, and that's what's nice is I know the supplements that I'm taking are getting me to the place I want. So, I think if
you're not getting a fraudulent vitamin D supplement, right?
Exactly. Yep. And so, getting tested is ideal, but if you can't do that, even once a year to me is pretty good.
Plenty. That's plenty. I mean, it doesn't oscillate that much.
Yeah. And so, and unlike vitamin C, right. And unlike vitamin C, that's water soluble, vitamin D is fat soluble, so your body can store it to some degree. And yeah, I think that, like you said, if you're not going to get tested, you may start on the lower end, 3,000, 5,000, and
right.
Until you can kind of see where you're at. But I have people come in and they're, oh, well, I was in the normal range. I'm fine. I was like, well, do you have the number from the test? And the gal showed me it was like 34. And I'm like, well,
the laboratory's reference rates, perhaps. Yes.
Yeah. And what are we looking at here? The average of the sick people who got tested, or okay, so you're saying 3 to 10 IU per day, 10,000, 3,000 to 10,000 IU per day. Okay, K2.
K2 is extremely non-toxic. You can take large amounts of it, but if you want your a dose to 500 micrograms, half a milligram, something along those lines. But I say that because the Japanese, for example, have a lot of multi-milligram products versus multi-milligram products, and they do very, very well on it. So I don't know that we've really established what a good upper limit is on vitamin K2, but I would shoot for half to a whole milligram or more a day.
Okay. The most of the vitamin D supplements I've seen that have K2 with them are like around 100. Some are 50,
Right.
maybe 125 or 150 is about as high as I've seen, and that might be where taking them separately might be a better way to go to get that higher dose. Okay, and then niacinamide, you talked about that already, but you were thinking.
Yeah, I think most people are best if they're not having any brain issues, depression, blah blah blah. They feel very solid on that end. 500 milligrams a day. Now, on the other hand, if they have a little bit of depression or a little bit of whatever, they should feel free to go into a multi-gram level. I mean, like I said, Dr. Hoffer showed that you could go up to 3,000 to 6,000, but I don't think many people will need that. Many people, I think, will do well, even with minor brain issues on 1,000 a day.
Mm-hmm. Is that a psychiatric benefit of niacinamide because it helps the brain detox, or what do we have?
Well, all of the above. The thing is, you have to remember, all disease, 100% of disease is increased oxidative stress, which is inflammation. Okay. And when you start producing more energy, have less inflammation, things get better. I mean, it's like look at schizophrenia. I mean, schizophrenia is in every sense of the word chronic encephalitis, chronic inflammation of the brain, and that comes from unexcreted toxins. So some of the other things you take, the vitamin C and all, and the methylene blue can get in. It helped the detox as well. So either getting rid of toxins or blocking the uptake of new toxins, all of those play to decrease any inflammation present.
Right. So basically, you're getting helping get toxins out of the cell, nutrients into the cell.
Right.
So, okay, B2. B2 is one I haven't heard much about until now. I mean, I've heard about it, but it's not been talked about much.
That's the one in the banana bag that's bright yellow. So you start taking the V2. Don't be surprised when you get the bright yellow urine. But of course, if you're taking the methylene blue as well, it'll be green urine.
Oh, methylene blue. I haven't tried methylene blue yet.
Great stuff.
Okay, so how much do you think on the B2?
400. I picked 400 because it is a standard supplemental dose, and because it's astronomically higher than the 2 to 4 milligrams on the multivitamin. And I haven't seen any studies that suggest a higher dose would be better. That's not to say in some circumstances a higher dose might be better, but I just settled on 400 milligrams.
Okay. Real quick, back to the magnesium. I know on a lot of the glycinates, that's really popular right now because the absorption there, a lot of naturopaths are talking about it. A lot of it's a bigger molecule because of the glycine is bigger. So to get 350 milligrams of glycinate, you have to take 4 capsules. Now, then that's a 350 milligrams, which is kind of what they're saying. Yeah, this is our recommended dose. But what would maybe be like the upper limit of like a glycinate, in your opinion? As far as dose,
just about tolerance dose. I don't know if that's a practical upper dose, really.
Yeah. So I wonder, because of the absorption, eventually you're gonna get to bowel tolerance even with glycinate.
Absolutely.
Okay, but it's not going to be as fast as with an oxide or a citrate.
I doubt it. No.
Yeah.
No.
Okay. So then the CoQ10, you were saying 600 to 1,000.
Right.
So that's one that is more expensive, but that's one that you may start with some lower dose if you need to.
Exactly.
And then the methylene blue, I remember you saying in the auto interview, 25 milligrams.
20 to 30 milligrams. If you take in the liquid, it comes as 1% a solution. And 1% solution is is 10 milligrams per cc.
Okay.
Okay.
And we do have Earth Harmony has one of those, a methylene blue product that's pretty good.
If you search hard, there's a few products out there that put it in the pill form, but that's more expensive. But it's a lot less hassle too, and you have a lot lower risk of
right
staining your body and your clothes.
Well, awesome. Well, I thank you so much for your time and explaining all of this and taking time out of your schedule to explain the Super 8 protocol. I know you've seen some pretty good results for yourself and for people you've worked with. Is that true?
They're dramatic results. Yes. Yes.
From pretty much anything you can think of.
Pretty much anything.
Because you're, like you said, all disease has a calcium buildup component, has a lack of cellular energy.
Increased calcium and decreased ATP, right.
Yep. And a toxin buildup. And if you don't have if you're not getting the calcium out of the cell, if you don't have the cellular energy to get rid of it, if you don't got the electrons, if you're not firing that electron transport chain and getting stuff going.
You got it. Yes, sir. That's it.
Well, Dr. Levy, I'm going to make a flyer on this, but I'm gonna reference several of your articles and books for folks to be able to reference and look into themselves. I know you have many articles on orthomolecular.org. All your books can be found on Amazon. Also, I've listened to several of them on Audible as well.
Well, all of my books except for Rapid Virus Recovery. But however, right. eBay covers them, and Barnes and Noble covers them, and Walmart.com covers them. So, yeah.
Are you ever going to put the magnesium book into Audible?
It's when they ask me. I mean, I get an email say, "Hey, we're interested in do that." So, but I'm not actively out saying, "Please do this" or something like that. But that would be a bad idea.
Yeah, that's one I haven't read yet. Well, again, thank you so much. And it's been a blessing to have you on the show. I sure appreciate all the work you've done and all you continue to do. And I just want to thank our audience for tuning in. We love y'all. God bless y'all. And have a lovely rest of your day.
Great. Thank you, Blake.
Hey, it's Nicole Haggerty, your holistic health and fitness coach. If you want to improve your health and life and get lasting results, you have to be the change you want to see. Let me help you be that change. Find me at NicoleHaggerty.com.
Hey, Eastern Oregon. My name is Justin Hernandez. I specialize in sports performance training for middle school, high school, and college athletes. My program goal is to optimize an athlete's potential on all playing surfaces. The Breakfast Club motto is creating elite athletes, but even better leaders.
This is Summer Steele of Body Sayorsa. I am a licensed massage therapist and certified personal trainer. I work with bodies of all shapes, sizes, and abilities to help them live a fuller and freer life. Connect with me on Instagram and Facebook under Body Sayorsa, Body SAORSA, or contact me at 541-786-5245.
My name is Blake Bars, and I'm General Manager of Nature's Pantry here in La Grande. I had a terribly unhealthy lifestyle when I started working here. I just didn't know how simple and powerful healthy habits could be. Now I love being able to lead others to vibrant health here at the store, through the health show, and in the health challenges we host twice per year. Learn more at naturespantry.life.
Hey friends, Lacey here with Wild Holistic Nutrition and Fitness. As a certified personal trainer and holistic nutritionist with 17 years of experience, I'm passionate about guiding others in their journey to wellness. I work in the areas of sports performance, group and individual fitness, personal training, behavioral and nutritional coaching, and gut biome health and assessment. I'd love to help you feel good so that you can thrive and meet the purpose you were made for.
Tim James here, founder of ChemicalFreeBody.com and host of the Health Heroes Show. After regaining my own health and having massive gut issues and surgery, I'm on a mission to help others do the same. If you're ready to make your health a priority, lose that weight, increase your energy, and just wake up and feel good, you can reach me at ChemicalFreeBody.com.
The information provided in this show is intended for your general knowledge only and is not medical advice. If you have or suspect you have a specific medical condition or disease, please consult your healthcare provider. If your provider has a strong understanding of nutrition and holistic health, even better. The opinions expressed on this show are those of the host and the guests and do not necessarily reflect the views of Nature's Pantry.